clicking of the hip or the back, a very deep dunk, a clonking sensation, most disconcerting. Patients will describe it to me as though their back is clicking or that it feels like the hip is dislocating on certain movements of either the hip, the leg, or the waist twisting around the back. What exactly is it? These sensations, as deep as they are, as worrying as they are in fact not at all of major concern, as long as the whole thing is first and foremost asymptomatic, i.e. not causing any pain or discomfort or any neurological symptoms down the lower extremities, down the waist below, or otherwise. Neurological symptoms such as pins and needles, numbness, weakness, or funny sensations down the legs. Symptoms around the waist include the likes of fecal or urinary incontinence, lack of sensation, amongst a whole host of others. So long and short, as long as there are no symptoms and that it is pain-free, it is not of concern. So the question is, what exactly is it? What it actually is something called snapping hip syndrome. Now, snapping hip syndrome, a syndrome essentially is a collection of symptoms which we cannot really piece together to give us a clear-cut explanation that might follow a full pathophysiological process. So, all in all, it's a collection of symptoms which don't really correlate with one another. Snapping hip syndrome usually occurs, so these clicking sensations, the dunk, that clonk sensation that occurs very deep inside over here, and you can't really put your finger on it, generally occurs on the back of what we refer to as hip flexion, i.e. bringing your knee towards your chest. But the actual sensation occurs when you are lowering the knee from the chest. And so in that situation, what happens is the muscle that we engaged to actually bring the knee to the chest is now fully contracted. As we now lower the leg, controlled, and that muscle is loaded, as it stretches out, what happens is it runs over a bony eminence, a bony prominence. And the most common bony prominence is associated with the muscle itself. So the muscle that actually brings the knee to the chest, what we call hip flexion, is called the psoas muscle, spelled P-S-O-A-S, psoas. There is psoas major, psoas minor, and they blend in at the pelvic region, and on the inside of this pelvis here that we feel at the iliac crest onto the iliacus. So depending on what reference you read and the anatomy that is. But the psoas muscle itself extends to the vertebrae in the lumbar spine. So between the thoracic spine and the lumbar spine, that junction T12 to L1, that's as far high as it goes, and it'll insert on the lateral aspect of those vertebrae, and it'll descend downwards. It'll then insert onto the iliopectoral eminence, i.e. around the iliac crest, as well as going further down to the femur, the thigh bone, the letter trochanter for that matter. Now, when we engage, like I say, we contract the muscle, we then load the muscle as we are lowering it in a controlled manner, and as we lower it, because the muscle is tight and it's contracted because it's loaded, it'll go over a bony prominence and it'll do that kind of sensation. Now, snapping hip syndrome can be internal or external. External generally refers to the iliotibial band rather than the psoas muscle, and that sensation is perhaps more on the outside of the hip, around this region, whereas internal snapping hip syndrome, which is the one that I'm usually faced with on a good number of occasions when patients are consulting with me, worried again, like I say, about their hip perhaps dislocating or otherwise. It's simply the tendon running over the bone like so, and there's nothing of concern in the absence of any other symptoms as described earlier. So there you have it, snapping hip syndrome in the context of a clicky hip and or a very clicky back that leaves you very, very concerned. Thank you for watching.